Good morning and welcome to the Robert J. Dole VA Veterans Town Hall meeting this April 15th, 2026. Appreciate everybody being here. My name is Gene Kimball. I'm the Deputy Public Affairs Officer here at Dole VA, and I'm going to be your moderator for today's Town Hall. We're going to provide updates today on VA programs and services, followed by fielding your questions. But let's review some housekeeping notes first. Next slide, please. Please be aware that today's session is being recorded, so others may view it at their convenience. If you have any questions at any point during the town hall, I'd encourage you to submit it via the chat window at your earliest opportunity. We'll answer at the best possible moment. When asking questions or making comments, please refrain from sharing personal information, whether it be your personal information or that of a comrade or friend. We do want you to be aware the link to this town hall has been shared publicly, meaning anyone could be logged in and watching us. So let's get going. Mr. Michael Payne, our Medical Center Director, is going to share some information with you this morning about a couple of events which just recently took place here at the Dole VA. Sir?
Righty, good morning. Thank you. Next slide, please. Okay, so thank you all for joining and happy Wednesday. So I recently had the opportunity to attend a final mile ceremony honoring an Army veteran who passed away in our facility and had no one to receive his body. This practice was first implemented by staff at the James A. Haley VA Medical Center in Tampa, Florida in February 2019 and began here at the Dole in October of 2023. The kinship between veterans in a community is a strong bond that endures long after deployments conclude and military service ends, and the camaraderie and respect among men and women who have served their country does not end with death, even when a veteran passes without family members or friends by their side. The final mile promising practice ensures that veterans who die at the VA Medical Center without a next of kin are nevertheless honored for their sacrifices and service. The Dole VA is an active part of this growing movement and has partnered with the local funeral home, veteran service organizations, and VA staff members to provide respectful ceremonies and dignified interments for veterans who have passed away without the presence of family. So the Facility Survivor Assistance and Memorial Support, or SAMS office, coordinated by Ms. Linda Rivera, collaborates with area groups such as the Combat Veterans Motorcycle Association, American Legion Riders, Veterans of Foreign Wars Riders, and the Wichita Police Department. These organizations have accompanied unclaimed veterans to their final resting places, leading noble processions with bikers bearing flags and police officers escorting with cruisers and lights. And so I attended that last week, and it was very moving, and it was always a good opportunity to honor our veterans in a way that dignifies them and reflects their service to our country. And so just as we work together to honor our fellow veterans in their final moments, we are equally committed to supporting and reaching out to those who may not yet be connected with VA healthcare. Because keeping within our mission of service, I'd like to briefly highlight an outreach event that took place last week. All right, I think somebody might have an open mic as well. Okay, so the Dole VA currently has nearly 34,000 veterans enrolled in VA healthcare, and we provide service to approximately 30,000 of them over this past year. Yet, within our 59 county catchment area, there are close to 36,000 veterans who are not enrolled in VA healthcare. And to better serve these individuals, our team held a virtual information session targeting unenrolled veterans. The message was simple and straightforward. To receive VA healthcare benefits, enrollment is required. So I believe Mr. Herndon will be presenting about the outreach program a little later in the program, and he will dispel some of the common myths that veterans have regarding VA healthcare and will provide information about upcoming events where veterans can enroll. I encourage each of you to help spread the word so that our fellow veterans can take advantage of the care and the benefits that they've earned and deserve. As I always say, I'm proud to work and serve every day to make a difference in the lives of our veterans, and I'm honored and privileged to lead the Dole VA in this endeavor. It's a privilege to serve each of you, and I want to thank you for putting your trust in us. Mr. Kimball, back to you.
Thank you, Mr. Payne. We appreciate you taking the time to join us and share that with our audience this morning. So next slide, please. Pharmacogenomics is a term that many of us haven't heard about, let alone understand. Pharmacogenomic testing began here at Dole VA about 4 years ago. Today, we've got two clinicians, Brittany Corona from our cardiac team and Dr. Corey McLean, a clinical pharmacy provider, who utilize results from pharmacogenomics on a daily basis to enhance the care to the veterans we serve. Brittany, why don't you start us off? Brittany, if you're talking, you're muted.
Better?
Much better, thanks.
Oh, so sorry.
No, you're
Good morning, everyone. I'm Brittany. I am the cardiac nurse navigator here at the Robert J. Dole VA, and I would like to share my role here, what I do, as well as how pharmacogenomics can literally save your life. So what is a nurse navigator and what do they do? My role as a nurse navigator is I guide all of our heart patients to ensure that they understand the condition and coordinate the care and treatments through diagnosis and recovery. There are procedures that have to be sent out here of the Robert J. Dole VA to outside hospitals that require surgical backup that we don't have here. And so my goal is to follow you to and from care. I provide all of the information for appointments. I follow you with appointments. I talk to you, throughout all of the coordination that goes on. And I make sure that your providers here ultimately have everything that they need to make sure that you come back to us and you have received the care that you need. Next slide, please. What are the benefits of pharmacogenomic testing? It is a one-time blood test that lasts a lifetime. It reduces in polypharmacy. It helps cut down on unnecessary medications. There's a 34% fewer adverse reaction. With this, because it's your genetic testing, there's less trial and error and fewer visits to figure out what medication works best for you. There is a 28% increase in efficacy of the medication that you are taking. And 22 genes are tested, results are destroyed after and not shared. Next slide, please. A real life example of the life-saving benefits is this story I'd like to share with you all. In August of 2025, a veteran came in for a scheduled heart cath. He did need a stent that required him to be sent out to Wesley Medical Center because it was complex. Next slide, please. The veteran had agreed to have this testing done and see what cardiac medications would work best for him. This test ultimately revealed that he would not respond well to a common blood thinner, which we use after cardiac stents, and he would need a different medication. This veteran was sent home on a blood thinner that was unlikely to be effective for him. Fortunately, though, as my role as the cardiac nurse navigator, I followed him very closely, and we were able to identify that his blood thinner would need to be switched the same day as his procedure. So he left Wesley Medical Center, was in contact with me. We went over his discharge medications and collaborated with pharmacy and the medical team here to get that medication switched, and he was able to pick up his new med that same day that would work best for him. And today, present day, he's doing wonderful, has not had any issues post-stent. Without the pharmacogenomic testing, the veteran could the veteran would have taken an ineffective medication for him that could very likely have led to another heart attack post that stent that he had placed. As much as pharmacogenomic testing results do benefit veterans here in cardiology, the benefits are far ranging just from cardiology. Corey McLean, clinical pharmacy provider, is here to tell you more about the benefits.
Perfect. Next slide, please. So thank you, Brittany, and such a powerful story about how we have some new tools that are really keeping us safe to making sure we're on the right medication, and especially in that particular case, you know, a very dangerous situation where we don't want to have a second heart attack or a stroke that results from ineffective blood thinning. It's certainly one of those things where we want to monitor that very closely, and that was a fantastic catch. And this is a fantastic test. We're going to go over a little bit how this works and how you might be able to get this if this is something that you are interested in getting through the VA. And so, as this mentions here, pharmacogenomics is a new tool for prescribing success. And as you look at this, I want you to actually close your eyes for just a minute and think about the last time that you got labs drawn from your primary care physician or from your behavioral health physician as they're monitoring labs for your medications. There's several labs you probably are getting fairly routinely. With the picture to the left here, you know, it shows our kidneys down there at the bottom, so you're probably getting kidney tests, and kidneys help us to identify how well we're getting rid of the medication. The next organ that goes up from there on that left picture is the liver. And so we often get just a general idea of, is the liver getting blood flow? Is it working correctly? And, you know, is our heart then circulating all of the medications throughout our whole body? And so there's so many different factors that come into drug selection and dose selection. And the neat thing is that pharmacogenomics gives us a brand new way of looking at how our body deals with medications. This now focuses in on the liver and on the drug metabolizing enzymes that are in our liver. Based on our genes, some of us have drug metabolizing enzymes that are running a sprint. You know, they chew through that drug really, really fast. And as a result, as you can imagine, you might need a little bit more of that drug than the average veteran, the average person that's out there. But the opposite is also true. It could be that we are, you know, crawling at a snail's pace in trying to chew up these drugs and to get rid of them. And so for those patients, they might need even less and less of that medication, or they may even need a different medication altogether. And so even though pharmacogenomics is not the whole picture, it helps us to get even more meaningful information so that we can provide safe and effective medications. Next slide, please. So that's kind of how the medication works. As our story just illustrated, it works with a lot of different disease states where it requires medications. We just talked about cardiology. There's also gastrointestinal, and so that's our proton pumps inhibitors for our stomach. Oncology, so cancer medications, behavioral health medications, pain management, and others. And when we look at this, there's always growing literature, and we're always getting more and more understanding of what types of medications might need to be changed over the course of time. But for right now, the VA has identified over 100 medications that could be impacted where we would know what we want to do with that particular dosing. Maybe when we start the medication from scratch, or maybe when we're having problems. And so you might be thinking, gosh, there's thousands of drugs that are out there. And that is true. It doesn't work for every medication, but it does really help out for a good number of medications that many of our veterans do take. Next slide, please. So the real take-home message from everything that we're covering here for pharmacogenomics from the drug perspective is that the pharmacogenomics test can help our providers to tailor the medication selection and dosing that is unique to your genetic makeup. And what we find is if we get this test before we start those medications, or if we get it early on, then it really can improve prescribing safety and efficacy. Next slide, please. So if you are interested in this test and you're interested in seeing, hey, do I have a medication that might benefit, from this? Or do I have a diagnosis where in the future I might need one of these medications? I really want to encourage you to talk to your provider, whether that is a clinical pharmacist such as myself, or if it's a nurse practitioner or your physician, if it's in behavioral health, cardiology, primary care. Any one of your providers has the ability to order this. If they can order a lab, then they are able to order this particular test and kind of talk to you a little bit about it. It is a one-time blood test, and it does follow you through for the rest of your life, so that it often can help with future medication selection. You do end up receiving results. We end up receiving the results back about 3 weeks later. This is a send-off lab test, and so we're often used to getting the results back instantly that same day. But this one does take a little bit of time for us to get the results back, and it does come at no cost, which is fantastic. We did leave a link here for people to be able to click on after this town hall in case if you are interested in additional information. And next slide, and I think that concludes our presentation. So I will hand it back to you, Mr. Kimball. Thank you so much.
Thank you, Dr. McLean, and thanks, Brittany, for your case study on this. What a great opportunity for our veterans to receive some of the latest in medical treatment capabilities here at Dole VA in Wichita. Thanks for that presentation. Dr. McLean mentioned how pharmacogenomics can benefit those in the mental health area. So Andrea Humphreys, a social worker within the behavioral health program, is here this morning to discuss how veterans can access the behavioral health program through our same-day access clinic. Andrea?
Good morning. You can go to the next slide. So the purpose of same-day access is to help establish a process for all veterans who present either to our medical center or out to any of our community-based outpatient clinics. The goal of this is to help enhance behavioral health or substance use treatment options for those who are currently in a crisis or needing some type of urgent need. So what this would look like is if you were experiencing something and you wanted to have an assessment, you could either come into the facility for either a face-to-face or a televideo appointment. And those televideo appointments can be done either like in person through the clinical video teleconferences at the C-Box to a provider here on campus, telephone or VVC appointment. The same-day access team is comprised of a couple of people. We have a nurse who kind of does our triage for us. We have psychiatric APRNs, clinical pharmacy specialists, psychiatrist, as far as like the medication piece aspect of it. And then for the therapy aspect, we have social workers and psychologists. Next slide. So again, with that, this would typically be facilitated either through your primary care team, the PAC team, specialty clinics, or any of the other C-Box that we currently have, or coming here to...
I'm sorry, I'm trying to figure out how to get the microphone to work, the headset to work.
And that would be in like building 5B. So what would happen is our nurse would do what we call like a 5-element assessment. So at that time, she would determine how urgent is the need of care. She would help identify any type of setting that she would feel would be appropriate. So that would be if it needed to be in person and do the face-to-face, if it needs to be video, if it can be done by phone. Then she will kind of ask questions as far as like what's going on, how can we meet your care today? And then after she gets a bigger picture of what's going on with the veteran, then she will follow next steps as to whether or not it can just be placing a consult for meds or therapy, or if they need to be seen by either a med provider or a therapist to talk about whatever is going on. She will also provide them with a point of contact information if they're not physically on campus in the building, so that if they needed to leave or do another appointment, finish their appointment out, that they would be able to access them in between that appointment time. Next slide. So the telephone contacts are going to be the typical business hours between Monday through Friday, 8 to 4:30. Again, it's going to be more for assessing like urgent need, crisis interventions, to be seen and assessed by the same day team. So if it is something that we can place a consult, they can go ahead and start doing that process for you. Or if they needed it to have a higher increase need versus being seen in person, then they will send them to the hospital. Again, primary care and specialty clinics have a chat with us so that they can do the assessment during those business hours. Anything outside of those business hours, they can assess to determine next step as far as like hospitalization to either the ED or anywhere else if it increases the needs. And then CBOX and off-campus locations will do the same as well. And team members will kind of assess to see how can we keep veterans out of the hospital, if there's a way that we can safety plan them, and try to kind of bridge the gap between getting services started or not for both medications and for therapy. And then I think that should be it.
Thanks, Andrea. Appreciate the information. What a great service that we provide for patients in our behavioral health side, that we provide that access to care relatively quickly. So appreciate your information on that today. Jesse Colmy, who is our telehealth coordinator, is here with us this morning to talk about some ongoing improvements in the My Healthy Vet system and some additional information on how to sign up for the program. Jesse? Jesse, you're muted if you're talking. Is Jesse on today?
I don't see Jesse on, Gene.
Okay. Well, then
Good
let's
morning.
go ahead.
Gene,
go
this
ahead.
is Shawan from Informatics. Jesse is not here today.
Okay. Okay. Why don't we just move ahead to the next section, if we could. Today, pharmacy is getting some extra exposure, having the opportunity to discuss both the pharmacogenomic program, and now Dr. Scott Hood, our Chief of Pharmacy, is here to tell you about a change that's taking place over a period of time. Dr. Hood?
Yes. So good morning. So my name is Scott Hood. I'm the Chief of Pharmacy Service, and I want to visit with you about some conversions that are happening. Many of you have probably received, when you receive your medications, potentially, a great example, maybe your cholesterol or blood pressure medication, where it says like, please take 1/2 tablet. Previously, that was a national directive that if there was veterans that could split tablets, that it was a cost-saving initiative that would help be able to utilize medication resources in other areas. But with us moving to the new electronic health record system coming in 2028, we're not going to be able to do half tablets anymore. So we're going to be changing how we dispense the medications. Pharmacy will be providing whole tablets of most medications when manufacturer supplies exist. There will be exceptions to this. You may have a particular medication that there is not a manufactured dose that is acceptable, so you have to split the tablet. That will be between you and your providers, and there will still be provisions for that. It will just be if there is a manufactured whole tablet strength, we will be sending that to you once that electronic health system rolls into place. So this does mean your medications might look different. And we've already started this rollout because we need to have it in place before this health record system comes into place. So right now we've started with most of the statin medications or cholesterol medications. A lot of them were half, so we've moved to whole tablets, and we've been sending out flyers and notifications. But this does mean your medication might look different. So we want to make you aware. Sometimes the tablet strength could be a different color tablet, a different shape of a tablet, or potentially different markings on the tablet. Next slide. So what should you do? Please read carefully. Always read the medication instructions that's provided on your prescriptions. It's very important. And not just for this, but sometimes providers might change your direction slightly. And so we want to make sure you're always reading that, even though it's a refill and it may be a med you've had for years and you know how to do it. But sometimes things do change. Maybe there's back orders and we're using a different manufacturer, different things. So just make sure you are reading those instructions. If you're unsure about your instructions, ask your provider or call the pharmacy, and we can work through with you and figure out what you need to do. And then please take your medication as prescribed. Next slide. So the transition period has basically begun. We've already started. Like I said, we're picking classes of medications. We picked some of the harder classes, and then we're kind of rolling it out slowly. So that this transition can occur before the health record. So it will be going through December 2027 with a gradual rollout. If we know you have a medication that will be transferred, we are sending mail outs. We're trying to send text messages. We're trying multiple ways to communicate this to you to make sure you are aware that these could be changing. Just want you to know your health and safety are top priority. We thank everyone as we go through this change. I'm happy to answer any questions anyone might have.
Thanks, Dr. Hood. I think the key point of this presentation is always read the label directions on your prescription bottle before taking it. So appreciate the update on that. And that, like Dr. Hood said, will transition into effect through December of 27. As you all know, significant portions of the facility were built here in the 1930s, so we stay pretty busy with construction projects to ensure that we're able to provide 21st century healthcare and services to the veterans that we serve. We have a new project chief. Used to be Nick Howard. Nick is now the deputy chief for facilities management, and Chris Berry has been promoted to the projects chief position. So this is his first time of presenting to our veterans, and he's going to tell us where we are on many of the projects going on here at the VA right now. Chris?
Hey, good morning, everybody. My name is Chris Berry. Like Gene said, I'm the projects chief here. And now we'll get started. So we have some minor construction projects going on. The endoscopy building, that's moving along well. We're estimated to open that in spring of 2027. This picture here is actually a little outdated now. They have the concrete poured there on the floor, and they're going to start setting the structural steel for that the first week of May. The Community Living Center building 60, that's moving along well. As also, they're finishing up the exterior currently and working on the interior, and they're also estimated to be completed by the spring of 2027 to start accepting patients. Building 26, the infill project. The canteen, I know it's a big one for everybody on the ground floor, is getting really close to being opened. And we're estimating, hoping end of April, early May for that to be open to start serving our veterans, which will be a nice change from what we've been doing. The rest of the space is planned to be open by the fall of 2026. Med-Surg project, we're working to replace the air handler, and that is estimated to be complete by the end of June or early July. Next slide, please. Here's a couple pictures of the canteen and retail store space. Like I said, it'll be a nice space when we get open, and hopefully here at the end of April or early May, we'll be able to start serving veterans. Next slide. All of our non-recurring maintenance projects, the boiler plant project is estimated to be completed sometime in late 2026. We're working through some contract issues and modifications for that, trying to get it completed. The chiller plant project, we're still working through design, hoping to have it completed also this FY to do a construction, hopefully in FY 27. Power plant project is currently up in contracting, working towards award for construction this year. It'll probably be awarded late this year, probably mid-September for construction award. The gamma cam and fluoroscopy projects are actually both completed. We just accepted those spaces yesterday and they started seeing patients in there today. So and we did our final inspections with the AE this morning just to verify everything's up and working. The fire alarm project, the design's completed and we are working towards a construction award of that in next FY and 27. So hopefully in early September, we'll have that going on. I think somebody has a hot mic. The renovate restrooms and lactation spaces, that is design is almost completed. We're expecting that to be done this month still, and then we'll move into construction, hopefully also in FY27 with that one. The cath lab equipment is 100% designed, and we have that up into contracting currently for a construction award this year, and the construction on that will be completed once awarded, about 9 months roughly of construction. So sometime in 2027 that should be completed. Digital radiology, that's currently up in contracting. We're waiting on an award to the architect for the design services on that one. The PET CT, it's also pending award to the architect firm. The wayfinding project, which I know is a big thing here, trying to update our signage and keep that current. We're working through some issues with contracting on that to get that awarded. Once that's awarded, we'll probably begin installation of the new signage sometime in early FY 2027. Similar with the nurse call there, that's working through solicitation and contract actions to be updated also late this summer, early fall. The site study for expansion, that's currently in contracting, waiting for award and review of proposals. And the repair risk project is currently just awarded last week. So we'll be updating some roofs and hopefully minimizing some of these water leaks that we have. And that is all that I have to update.
Thanks, Chris. For anyone outside the VA, please understand that our facilities maintenance crew and the engineering crews and our construction contractors are extremely busy around here. Obviously, I think you could just see it in the slide presentation there. They do a great job of keeping everyone informed and aware of what's happening in construction. And there are some places around the facility that that you can be inside and look out some windows in the hallways and see the construction taking place. It's always kind of interesting for some of our inpatients who have the ability to go down and watch on a daily basis kind of what's happening around here. So, and quite honestly, a number of employees do the same thing. So thanks, Chris. We appreciate the update. So earlier, Mr. Payne mentioned about eligibility and enrollment, an education session which took place this past week. Jeff Herndon, our public affairs officer, is here this morning to share some of that information with you. Jeff?
Hey, hello everybody. I am flipping slides today and also a presenter. So if I stumble through this at all, please accept my apologies for that right now. The Department of Veterans Affairs has undertaken a campaign this year to ensure veterans are aware of the valuable benefit they have earned and deserve, VA healthcare, and how to get enrolled. In addition to the events and outreach we conduct locally each year, VA has pushed out information to millions of veterans who are not enrolled for VA healthcare. Thus far, those efforts have been met with impressive results, enrolling 100,000 veterans faster than we did 6 of the previous 7 years. As you can see, we have experienced an increase in enrollment locally as well. There's a good comparison of March 2025 with March 2026 right there, where we enrolled nearly 80 more veterans this year. For the first time since I've been tracking enrollment over the past handful of years, we have enrolled at least 100 veterans each month for the first half of this fiscal year. So huge accomplishment for us. We're on our way to enrolling close to 1,400 this year. So let's take a few moments to debunk some myths. I'm a veteran as well, having served 22 years in the Army, so I have heard all of these and more before I started working for the Department of Veterans Affairs. I even used some of them myself. I was retired for close to 15 years before I enrolled for VA healthcare. So myth number one, you do not have to have served in combat or sustained an impactful injury to enroll for VA healthcare. If you served honorably and met the time qualifications, you are likely qualified for VA care. Changes made through the 2022 PACT Act increased the number of veterans who are eligible for VA care. Myth number two, not using VA for your health care does not improve accessibility for others. VA staffs every facility properly for the services it offers and the number of veterans it serves. Generally speaking, access is not an issue. If access becomes an issue, rules implemented through the Mission Act of 2018 allow you to get care from a community provider if necessary. It is one of VA's highest goals that you receive the care you need, when you need it, and where you need it. Myth number three. Many of you are young. You have a job so you can support yourself and your family, and a benefit of that job is health insurance. You don't have to give up that insurance or any other private health insurance you have to receive health care through VA. You get your VA care and you still have your private health insurance, giving you coverage and peace of mind that most Americans do not get to experience. Many veterans think making too much money automatically disqualifies them for VA care. Income is not the only factor considered when determining your eligibility. There are multiple other factors that are considered. And finally, it is important to know that just because you have a service-connected injury or disability, or just because you retired from the military, does not mean you are automatically enrolled for VA care. No matter your circumstances, you have to fill out an application. VA is the nation's largest healthcare system. That means, in many cases, VA has the services you need under one roof. I can sum up this slide by simply saying VA provides you with quality care, cost savings, and lifelong enrollment. An unprecedented number of veterans trust VA with their health care today. I count myself among that 93.6%, and you should too. We're offering multiple opportunities over the next few months for veterans to visit with us. We'll be in Salina this Saturday, April 18th, followed by Hutchinson and El Dorado in May. We then have 3 events lined up for Wichita, and please note that we'll also be in Great Bend next Saturday, April 25th. You can get more information about all these events on our website. An internet search for VA Wichita will typically get you there, but I'll spell it out for you just in case. va.gov/Wichita-health-care. As a fellow veteran, I encourage all of you to apply for VA healthcare. Don't try to figure out on your own if you're eligible or not. Just submit an application and let us make that determination. Thank you. We look forward to seeing you in the halls of VA facilities soon. Gene, back to you.
Thanks, Jeff. Something that I wanted to point out is, if you've joined us today and you're more than likely a veteran, we're probably preaching to the choir. More than likely, you have already applied for and are receiving health care here at the Dole VA. Some maybe not, but more than likely, probably. What we would like you to do is to help us let those who are unenrolled, veteran friends of yours, acquaintances that you think might not know about this, give them some information. Let them know to contact the VA and that they do need to enroll. They're not automatically enrolled. They also get great benefits if they do enroll. So thanks for your help. So this brings us to the question and answer session. part of the program. So I've been kind of following the chat, and it doesn't look like we have any questions in the chat. So I would offer at this point in time, anyone to unmute themselves and ask a question if they have any. Okay, next slide, Jeff. Just so you know, the recording of this meeting will be posted to the Dole VA's website. Jeff talked about that just a few moments ago. And at the bottom of the page, of the home page, on the About Us page, it'll be linked there either later today or early tomorrow morning. So again, thanks for joining us today. We look forward to seeing you again soon. Thanks so much.